So some other thoughts, tends to lengthen in the extremities and shorten in the torso. Can lead to foot pain through either plantar fasciitis or calcaneal tendonitis. Low back pain from hyperlordosis with an anterior pelvic tilt or from a posterior pelvic tilt as well. And again, with the sacrotuberous ligament crossing the SI joint, it can lead to sciatic type symptoms as well. More specifically with this line and talking about driving, people drive way too much too, and they don't drive well. So the gas is important because that's where your foot is. So that's where people line their foot up. Well, if you line up with the gas, you're externally rotated the entire time. So that's going to increase the tension on the lateral gastroc, biceps femoris, and piriformis because of the external rotation of the hip. So what I tend to recommend is, they line their foot up with the brake because that's important, and then they externally rotate to the gas. But your foot's on the gas all the time. So that's line up with the gas and then either shift over to the brake or internally rotate to the brake. Who drives at 10 and 2? One person. Wow. Why? Okay. There's actually a research study from a couple years ago looking at the 10 and 2 position. There's no reason to drive at 10 and 2. Apparently it was said by some driver's ed instructor back in the 40s, and it's become law at this point. So what they did was they looked at us biomechanically to determine what would be a better position. And 5 and 7 is actually a better biomechanical position. 10 and 2, we get internal rotation of the shoulders, flexion at the shoulder. Well, that's real close to a Hawkins test for shoulder impingement. So we're creating shoulder impingement with driving. So if we come up to a 5 and 7 position, basically we're in anatomical position, and we just bend our elbows up, and we're at 5 and 7. So it helps keep the shoulders back, helps keep the shoulders open. If the shoulder scapula are better retracted, you have better head positioning as well. So just another simple little tip for patients to improve posturing.